Good patient experience from me is when the office staff's friendly and it's like they know you.
Good morning. Good morning. How are you? Good.
The doctor also comes to you as a friend and somebody that's really concerned about you like your family would or someone like that. That's a good visit with me. And that's the kind of person Dr. Richards is, as if you were the family.
To me, exceptional patient experience starts with providing patient-centered care. Along with that, it's making sure that patients have timely access to care when they need it, and making sure that that care is high-quality care, that we're addressing their needs and their concerns in a compassionate way, in a way that suits their schedule most ideally. It starts at the front desk. The moment the patient walks in the door, they should be greeted with a smile by front desk staff.
I had been with another doctor for over 30 years and changed over to Dr. Richards and been delighted with it. Everyone's very friendly here. I noticed that from the very beginning. Before I even said who I was, they knew exactly who I was. So I always have that when I come in.
Ideally, if our staff know who the patient is, or if they have an idea, it's 9 o'clock and there's a patient walking in to be seen, they're probably the 9 o'clock patient. They greet them with a smile always, and if they can, addressing them by name. I think it makes patients feel welcomed and that we were expecting them and we're looking forward to providing them with care. From there, it continues. When nurses are taking patients into the room, they again try and address everyone by name. And over time, our nurses start to develop relationships with patients and will remember to ask, how's your dog doing? How's your mom doing? Did you guys get moved into the new house okay? It's remembering those little things. And there's tricks to doing that. Using your electronic medical record, you can put sticky notes and your staff can do the same thing in charts to remind you about those little things that your patients share. From there, it continues with utilizing our electronic medical record system to the best that we can. Epic is a wonderful system that we have, and it allows us to stay in contact with our patients. We work hard to get them set up on MyChart so that patients know if they have a question when they leave the clinic, they can send us a quick message on MyChart. It saves not only our staff time, because it's not a missed phone call that they have to call back, but it also improves the care for patients. If they have a question, they weren't sure about a new medication or such, they can reach out and we can answer that directly. It engages patients. It's called MyChart for a reason. It's patients' chart. It allows patients to see their different problems, and it allows for you actually to share your notes with patients if you'd like to. I found that this can be really beneficial for patients who maybe don't understand all of their conditions fully, or who have family members that haven't been able to be present at the visit and want to know what's going on. There's a quick checkbox that I can check, and the whole note is shared with patients. They can take it home and review it with their family members so that they understand what was going on. This helps not only make families feel at ease and patients, since they know what's being said and what the plan is, but it also saves time because you don't have other family members calling back asking what happened at Mrs. Jones' visit. I think that adds a little bit of a personalized touch to how we care for people. They quickly realize that they're not just another number in the clinic, that we actually care about who they are as a person, and we're here to address their concerns.
I first started using MyChart when I became affiliated here with this office with Dr. Richards.
I'd never used MyChart until I started coming to First Health. And since I've been using that, it's been awesome.
With MyChart, I can go in there and have a conversation.
I can see all my records. I can see my office visit. I can get messages from them to remind me of appointments or anything that might affect my health.
It's completely different, and I feel comfortable using it.
The biggest thing that I like, though, is the office visit summary. I can go back and look at what we discussed in the office.
The other thing that it allows for different ways to deliver health care. So one of the things that I believe is that healthcare is moving outside of just our office. Sometimes an urgent need arises. A patient has a urinary tract infection or a simple cold, and they need to be seen right away. There's a couple of different functions that can help with this. One, on my chart, patients are able to put themselves on your schedule, which shows that we care about their time. Another thing that Epic allows are for e-visits. Sometimes people aren't able to make it to the clinic, but they can go online and have an electronic visit with you through Epic. Not only does it make patients feel that we care about them and address their needs on their time, but it also saves us time here in the clinic as well, since we're able to see patients both here in the clinic and online. Our medical record system can really help provide for a better patient experience. We have the ability to pre-chart in our system, which means that you can look at your schedule right in the morning during what we call our huddle time, which is before our first patient of the day, and quickly get a rundown of each patient. Miss Jones has diabetes and high blood pressure, and during my pre-charting time, which might take maybe 2 or 3 minutes, I look back and see that I increased her blood pressure medicine at the last visit. I quick type that into my note, and then when I get into the room with her, I can walk in and say, "Hey, Miss Jones, how are you doing since we increased your blood pressure medicine at the last visit?" That immediately tells her not only do I know her name, but I also remember our visit from last time, and I'm focused on what the results have been. I think it just allows for a little bit more personalization of the visit and makes people feel like we care and we're invested in their health.
It's an interesting experience. It's not just going in and getting, a checkup and say, okay, you're going to stay on your medication, or we're going to bump you up or bump you down, and as far as the amount goes. Her holistic approach is more inclusive. It's asking more about your lifestyle and what are you doing, because apparently it's going to, it contributes to your well-being. It's not just where do you ache, what's your problem. Well, my health has improved. I went from 236 pounds down to 191 in 8 months. My waistline went from 46 to 40. I have to buy a whole new wardrobe, but I sleep better. It's more than medicine in a way. I mean, the first time in my life a doctor gives me a reading list, of books, and she's talking to me about diet. And the main reason I think she started talking about that was because of high blood pressure, where before it's just, what's your ailment? Where do you hurt? Let me prescribe this. Where do you get your drugs from? Things like that.
Dr. Richards has helped me since I've been coming to her to be able to get off of blood pressure meds that I've been taking probably 8 to 10 years through diet and her encouragement on the diet that I've been able to do.
No meats, no dairy. This isn't like being on a diet. A diet is something I think you stop at some point in time. This is a lifestyle change.
One change that we've made here in our clinic recently that has really helped improve the quality of care we deliver is by allowing all of our team members to operate at their highest level of training. Women should be getting mammograms every 1 to 2 years, depending on the guidelines that you choose to follow. That does not require an office visit. My staff have reports that can easily be run through Epic to identify all the women that we take care of who are due for a mammogram. They can order that mammogram, call them, help them get that mammogram scheduled, and then send it to me for a cosign. It makes it much more effective to deliver high quality care. We do this not only with mammograms, but with colon cancer screening, pneumonia vaccines. We're able to find our patients that we take care of who have high blood pressure, who maybe missed their last appointment, or were seen somewhere else and discovered to have high blood pressure. It allows us to capture these patients, reach out to them, and get them scheduled to be seen to address their high blood pressure. That improves not only the quality of the care we're providing to the population that we care for, but again, it goes back to showing patients that we care about them and we're thinking about them. This allows us to practice smarter. We're able to deliver high quality, evidence-based care in a time-efficient manner as a team.
I feel like Dr. Richards, again, feels very connected with you and concerned about you, and not just, I'm a patient, and so how quick can I get in and quick can I get out? But she takes her time to discuss things with you.
The thing about the list, the reading list, My wife says, no one should give me a reading list because I'm an avid reader, and I followed up on it. And it's kind of startling, to see that, what you eat really affects your health.
I've had a lot of memorable patient experiences, but the one that stands out most was a woman that I met in residency. In residency, I implemented a survey with some of my patients to look and see what the rate of food insecurity was in our clinic. It was very surprising how many patients of mine were food insecure. In particular, one woman who I saw had a history of uncontrolled diabetes and had been seen not only by me, but my co-residents, and deemed non-compliant with her medications. And it was felt that she didn't care. I gave her a survey asking about food insecurity, and it started a conversation with her. I found out that she has a very limited income. The majority of her money went to the electricity that was leaking out of her home that she shared with her granddaughter. And they had very limited money left for food. Not only that, but she had to walk over a mile to the grocery store to get her food. As a result, she was terrified to take her insulin because if her sugar dropped, she didn't have food in the house to eat to keep it up. All of her food went to her granddaughter. And so she didn't take her insulin, and her diabetes was not controlled. None of us ever stopped to think about how that influenced her health and her non-compliance. It changed the way I asked questions. Speaking with this woman about her struggles with food and how it impacted her diabetes has changed the way I ask questions when I see patients. I ask about food, the cost of food, the cost of medications, and patients aren't always used to that. But if we don't ask those questions, we won't ever be able to help them better control their diabetes or their high blood pressure. If someone can't afford the medications, you're never going to lower their blood pressure. One of the great resources we have at First Health is community health. And so for patients who struggle with housing or food or living situations, personal safety, we can get community health involved to address these issues and help them afford their medications and get in a more stable housing environment. We need to meet patients where they are and ask these important questions.
No one has ever asked, what do you eat? What's your daily routine like? What do you do?
When I meet with Dr. Richards and we talk about those things, it's like we're talking one-on-one and not like she's the doctor and I'm just the patient. She explains things and goes over things. And so I think that's awesome that she takes the time to do that when I'm meeting with her.
Well-being and self-care is so important to physicians and other healthcare providers. If we don't take care of ourselves, we can never take the best care of patients. I have 2 young children, and my husband's gone a lot for his job. So self-care is so important. I'm a type A personality, and I think most healthcare providers are as well. So I like things with a result. I love gardening, and that has really become something that really helps me maintain my sanity. It gives me results. I can grow my spinach in the ground and then it comes up and I can clip the leaves and put it in my morning smoothie. It's so important that people find what the hobby is that works best for them. Be that running, exercise, a Peloton bike, gardening, reading, but really something that provides them joy and some kind of disconnect from the hectic life that is being a physician and a healthcare provider. We take care of patients. That's our job. We have to take care of ourselves as well.
If you're going in to see a new doctor and they come in and they're overweight and stuff like that, I mean, then they're telling you to go, no, lose weight, change your lifestyle. Do you really believe that? But you've got a young, vibrant, young woman, 2 children. She's telling you what she does and just making a suggestion. Maybe you want to take a look at this. Well, I took a look at it. I went beyond that, and then I'm reaping the benefits right now.
Having met Dr. Richards and being able to talk with her and know that she's living the things that she's asking me to do through her lifestyle and her diet, that's encouraging.
Another very important thing that I believe in is disconnecting. In our culture, in this country, it is expected that we should always be able to be in contact with everyone. We're on Instagram, constantly getting updated with what everybody else is doing in their life. In between getting bombarded with emails and requests, not only just personal emails, work emails, patient requests. Our nurses are asking us if we can order this lab or do that. It can be overwhelming and exhausting. And so I believe it's very important to have intentional time every day where you really truly disconnect and you are present. I don't have my personal email go to my phone, so I don't get a million dings every day in between patients because Oshkosh Bagosh just sent me an email that they have $5 bodysuits for my kids. And so that helps take some of that constant stress that we have every time we get a notification. I also don't participate in social media, and I have true disconnect time from electronics, where my phone is on silent or off and I cannot be reached. And that's okay. It helps reduce our stress level and give us that time to really reconnect and be physically present at home or in our own personal lives. Burnout is a very serious issue for physicians and healthcare providers these days. If an accountant gets burned out, maybe it means you missed out on $100 on your tax return. When a physician or a healthcare provider gets burnt out, it means decreased quality care to patients. That impacts their health, their life. Taking that time to disconnect, to be physically present in your thoughts without any other distractions, having those times where you do whatever your hobby is that you enjoy and you work on that self-care, that reduces your risk of burnout. One of the great things about First Health is that they take burnout and provider well-being very serious. Hence why we have a Center for Provider Well-being. Whatever it is, they're there to help, and they're there anonymously if needed, be it counseling or someone to talk to, or trying to find resources such as childcare when your child's sick and can't go to their regular daycare. They're there to genuinely help and provide those resources and connections. Optimizing patient satisfaction not only improves outcomes, but it also improves the well-being of staff. When patients walk in the door, my staff greets them with a smile, and patients smile back. Smiles are contagious, and it starts there. When patients are roomed, my staff has conversations with them about how they're doing. And they're gonna follow up on those conversations. My staff's gonna wanna know how the new puppy that Miss Jones got is doing, and they remember those things. It allows patients not only to look forward to their visits, but us as staff, it allows us to look forward to seeing patients as well so that we can catch up with them. We also do things to try and maximize the way that we're delivering care, and that helps reduce not only the stress level, but also just the overall amount of requests we get bombarded with some days. We try to be proactive in our healthcare delivery. My staff run reports to see who's due for mammograms, or who's due for colon cancer screenings, or who's due for pneumonia vaccines. We reach out ahead of time in a proactive way to get these things scheduled so that we're not left reacting to them. Overall, this saves time, and patients really appreciate it, and it improves their overall satisfaction of receiving their health care with First Health. Celebrating accomplishments like reaching green for our mammogram screening rate is very satisfying for us as a team. We celebrate it, and everyone realizes the individual role that they played on the team in reaching that goal. They are motivated then to continue to provide that high quality care. And after the mammograms in green, next step is the colon cancer screening or the pneumonia vaccines. It keeps everybody motivated and working towards that goal of providing high quality patient-centered care. Providing good quality medicine where we do the right thing and patients know it, they appreciate that, and that leads to satisfied patients, happy staff, and optimal outcomes. It's a constant circle.
If I had some advice for a medical provider, it would be this. A doctor will have to know a little bit more about people, not just what cures this, you know. It's got to be, how can I help you help yourself to live longer, live healthier.
I believe that my work is a way that I serve. I believe that we're all called to serve, and we're all given different talents that allow us to serve one another in a different way. I believe that my talents that I was given allow me to serve everyone as a physician. Medicine is my career that enables me to answer my calling to serve.